because this happens every time. So while I'm getting all organized and set up, I just wanted to take a minute to let you know that, oh, hang on, maybe I'm not going to be live today. Hang on, we're having an error message. Let's just see if that's actually true. Am I really not live? Oh, I am live. Okay. All right. Whatever it was, it's gone. All right. I had an error message pop up that for whatever reason we weren't going to be succeeding at this today, but for whatever good reasons, we are here. So now that I know I've got you, hey, first off, I want to let you know I'm just really thrilled to see how many movie buffs are here amongst this group. I put up a poll there a few days back, just a curiosity thing, to see which movies might be interesting to see a recreation of. In no way would I want to eliminate the originals, because I agree with you. You can't touch that, without doubt. I have a warped sense of humor, though. I'd like to see what, a new revamped version would be like. But anyway, thank you for speaking up on that one. In no way am I going to be trying to remake any of those movies, so I think we're all relatively safe. Okay, so now that I'm gonna got that out of the way, and hopefully you're all relaxing and not going to give me too many more angry faces. I just want to welcome you to today's edition of Tea Talk. It's always nice to see you here. And last week we talked about different ways to combat sleep disorders. And this week, I got to thinking about that after I left the call. Okay, yeah, I've given you some coping skills, but what about the different reasons as to why people have, different sleep disorders? So the average adult, we need at least 7+ hours of sleep a night, good, solid, restorative rest kind of sleep. If you're not getting that, there's a chance there's some sort of a sleep disorder in the background. And it's helpful to know what it might be. Now, having said that, what I'm about to say is in no way to substitute your doctor's advice or any medical advice or anything like that, nor is it meant to be any medical advice. This is just possible different causes that you could actually bring up with your physician or your naturopath and see if it resonates. Because if we don't know what the cause is, you're going to be chasing the symptoms all the time, and that's not a very fun life. I know that. So I'm just going to cover 6 basic ones today, and they may actually trip off some other ideas as to what it could be related to as well. And I'm hoping that maybe, for all of you who are suffering from sleep disorders, that something in here is a little bit helpful for you. Okay, so the first one I want to talk a little bit about is sleep apnea. You've all heard about it, where people have to wear the mask, that CPAP machine, I think is called. And the reason that that's necessary is because if you have sleep apnea, you stop breathing for a long, what feels like a long time. And I've had this happen. My husband does this sometimes where, 30 seconds later, you're starting to think maybe you better pounce on that person and start applying some CPR. It's scary. And then all of a sudden they go, and then they keep breathing and everything is normal. So that would be, typical symptoms of that. Also, excessive snoring can be a result of having sleep apnea. You could also be feeling a lot of excessive daytime fatigue. I know people with sleep apnea that they just cannot stay awake. They've actually have their spouse drive them from job to job while they nap in between. It's not an easy lifestyle, as you're sure, as you know. And like I say, sometimes you just wake up gasping and you don't realize that you haven't been breathing for a while. So you might wake up choking, or the next morning your mouth is very dry and sore in the throat. That's another, possible cause of it, is the sleep apnea. Morning headaches, you may find that it's tough to focus on different things, and maybe your moods are swinging a little bit heavier than normal. And lack of sleep will do that. And so that's something that, if that resonates with you a little bit, you may want to talk to your doctor about that. They can do tests with you. They may do what they call a sleep study. I'm not sure what the latest procedure is, but with that, you come in for a night at the hospital, they hook up about 24 different wires and electrodes and whatnot to you. You sleep, and they monitor what happens with you so that they can determine what's the best thing to do for you. So that's one of them. Another one is called restless leg syndrome. Now, when I Google restless leg syndrome, it's interesting because it says there's no known cause. And I actually beg to differ. from that. Now, I'm not saying this is the cause every time, but sometimes there is a reason you have restless leg syndrome. It could be a neurological disorder. I know that it's very frequent in people with Lyme disease, for example. They suffer restless leg syndrome. Any sort of neurological disorder could be the cause of that, so it's something to consider. Also, it could be a deficiency of different mineral supplements, whatnot. Iron, if you're low on iron, that could be causing restless leg syndrome, and that can keep you awake. You might be deficient in magnesium. That's another one. B6 is another vitamin, which if you're going to take any B, you want to take the full complex, get a tablet that has B complex on it. It should be a good balance of it if it's done right. Okay, the other thing you can try is something called quinine. You can find that in tonic water. You can drink that. I'm not sure if you can get that as a supplement at a health store or not, something you can look into. Find out about that. So you could get your magnesium levels tested with your doctor. It's something you can check with them. They may suggest a certain amount of magnesium. What I would suggest if you suspect that that is the case, that you're lacking magnesium, is just slowly increase it, maybe a little bit every few days until you notice that there's a difference. If you hit bowel intolerance where your bowels go loosey-goosey, then you might want to back off of it a little bit. So okay, another one that can keep people awake all night is something that is known as chronic pain. Now, we know that there's a lot of different reasons for chronic pain. It could be accidents. It could be a disease. Believe it or not, stress can cause chronic pain. Other causes of chronic pain, believe it or not, is trauma that's actually stored in the body. That's actually how sometimes it's presented. I know that sounds very weird. Another reason for chronic pain might be that you're in a sympathetic state. It's a nervous state where you're stuck in fight, flight, freeze all the time. You don't relax. Your shoulders are always attached to your earlobes. You're always looking over your shoulder for the next bomb, the next shoe, the next what's going to happen next kind of scenario, because you've kind of forgotten how to relax, and that can cause chronic pain. So if you want to look into that, you can Google something called sympathetic versus parasympathetic state. So that's another thing to look into. You can always go to support groups for pain management. That's an option. I found some of those helpful when I was at my worst with Lyme. Sometimes just the distraction and camaraderie with other people is very, very helpful. And that's another thing, is you can distract yourself with a hobby, or maybe give yourself a special spa day, or you can also work on your mitochondria, work on your cellular levels. Sometimes when we get our nutrients to the right levels, the right balance, that sometimes for whatever reason seems to eliminate chronic pain. So these are just little things that are possibilities. I'm not saying this is the magic end all be all. There's lots of things you can do for chronic pain. If it's an inflammation thing, you can take turmeric, you can take CBD, get yourself a good pure organic non-GMO supplement of any sort of like that. Those are things you can look into. Again, until we know what the cause of the chronic pain is, it's kind of hard to go much further on that, but it's one that you want to find a way to address. So Google sympathetic versus parasympathetic nervous system and see if any of that resonates with you. Okay, mental health, that can really destroy a person's sleep too. Anxiety, depression, ADHD, stress, those things, where maybe you can fall asleep, you wake up with the big alarm bells going off and you're in that, fight, flight, freeze mode. Again, that's your sympathetic, parasympathetic nervous system kicking in at times, and it can affect a lot of things. It'll affect your sleep, it'll affect your moods, it'll affect your digestive system, even how you're absorbing your nutrition. So it's really important to get your stress and whatnot under check. Find a way to relax, because it will take away from your sleep. And of course, if you're not sleeping, then you worry about not sleeping. And when you're worrying about not sleeping, guess what? It's going to make it even worse. You're not going to sleep even more. So definitely find ways to relax. There's all kinds of different forms of relaxation therapy. Some people love meditation. Some people love to go burn it out in a gym. Maybe go float in a pool for a while, or do a personal spa, or do some meditation, or do some deep breathing, whatever it is that helps you to relax. If it's therapy for you, maybe baking or a hobby, then do it. Just remember to exhale all the bad stuff. Breathe in the good stuff, exhale the bad stuff. Okay. Another thing is medications and or supplements, vitamins. Those things can actually keep you awake at night. And the medications that have steroids, like inhalers, at night, that can affect your sleep. If they have some sort of stimulants in them, that can affect your sleep. Certain anti-seizure drugs, same thing. Antidepressants, etc. Those sorts of things. You may want to talk to your pharmacist if you're on different medications and you're finding you're not sleeping, and ask them which one of these is affecting my sleep. And it's amazing what a pharmacist knows, and it's a lot quicker to get the answer that way, and you're going to get a more accurate answer than you will from your GP or your naturopath. And I'm not saying they don't know, I'm just saying that that's what the pharmacist does. They know their stuff that way. So you can ask them on that. Also, as I mentioned, vitamins, you could have too much or too little of different things like B6 and B12. Same with vitamin C. I know that too little of vitamin D can disrupt your sleep patterns, so you might want to increase your D. Sometimes too much or too little of vitamin E can do the same thing. Not having enough Bs can do that. Or if you take your multivitamin, vitamin, that wasn't what I was going to say. I'm not British. Multivitamin at night, maybe you want to consider taking it in the morning and say, early to mid-afternoon, and not taking it at night, because again, it's a stimulant. Same with stimulant. I will get that word out. Same with zinc. Vitamin D, it's like the sun. It kind of helps you. So you want to take that more in the daytime than you do at night. And it'll be less of a stimulant for you. Now, having said that, some of us are different. We actually do better by taking some of our vitamin D with our magnesium and our calcium at night. That actually helps us to sleep. So you yourself, we're all unique, we're all different. You're going to have to figure out which ones are affecting you in what ways, and then just reschedule whichever ones are affecting you accordingly. So, okay, last one, because I didn't realize this was going to take too long, guys. I'm hoping this is good for your time here. Is a hormonal imbalance. If you're finding that you're having heart palpitations, you got the night sweats, you're waking up in the middle of the night, pacing the floor, and there's no particular reason, you're just wide awake, it could be a variety of hormonal imbalances. It could be a lack of melatonin. It might be too much cortisol. It could be your thyroid is hyperthyroid or you're hypothyroid. Your estrogen level, if it's too high or too low, again, that can affect things. And same with your progesterone. And guess what, people? This is not just women. This is men too. Men have a hormonal system as well. So something else you can look into. I do find that GPs are not quite as excited about looking into hormonal imbalances as much as a naturopath might be. So you may have to dig to find out how to do that. So those are the 6 basic things that can be huge causes of sleep disruption. And just a few more things, if I didn't mention in the last episode, that you can do that, will help you in the meantime, is you can look into valerian root. You can get that as a tincture or a tea. Ashwagandha, I use that actually myself twice a day. That helps with my stress. As I mentioned, PTSD is one of my friends that I get to live with. CBD, that can be very helpful as well. GABA, just like it sounds. G is in golf, alpha, bravo, alpha, just the 4 letters. You can get that at any supplement store pretty much as well too. Those are all things that can help. A cup of chamomile, a nice magnesium salted Epsom salt, that's where I'm looking for. Epsom salt bath at night, have a good soak, in a nice dimly lit bathtub, that can be helpful too. And just remember, don't get into your emails or all the things that, you could look after tomorrow. Make yourself a wind down time for the end of the day. And that's how you want to chill it out. So I'm going to just see if you have any questions, comments. Okay, not sure what that is. I guess that's it for now. So if you think of any other questions that you want to ask or any comments you want to make, please do. If you enjoyed what you saw here today, please hit that like button. It helps me. If you happen to be seeing this on YouTube, you can hit the like button there as well. And while I've got you, I just want to let you know there is a webinar coming up on salt. I did post the link to that on there. It's oh crap, I just lost my train of thought. Sorry, background distractions. But yes, we do have one on salt, the dangers of salt, the dangers of lack of salt, what salt is good for you, what's not. You want to catch us for that. That's coming up in a couple of weeks. That's posted. All right. Take care, everyone. Thank you so much for being here. I'm sure I'm going to catch you again soon, and stay safe. Good to see you, everyone. Bye for now.